Hi, my name is John Consalvi, and I'm the CEO of LinguaHealth and Grupo Lingua. Today I have Elizabeth Steffen visiting us. She's going to be talking about her experience working as a speech-language pathologist in a hospital setting. Thanks for coming, Elizabeth.
Thank you for having me.
Thinking about students in graduate school, they have a lot of courses, they have a lot of different things that they're required to do. Some of them are thinking, maybe after I get out, I'll work in a hospital. They might not have ever stepped foot in a hospital, or they might not understand what that means. So what would you say to those students thinking about working in a hospital after graduation? What would you recommend that they do to prepare themselves to be successful working in a hospital setting?
To prepare to be successful in the medical setting, there's a lot of different things that speech pathologists can do. They can shadow. I recommend shadowing a speech pathologist in the medical setting as early as possible, almost in undergrad, checking out the setting to see if they really like the area of focus. Then just taking courses, science courses like dysphagia, really gives them a great perspective of what we do a lot of the time in the medical setting, in dysphagia evals, bedside swallow evals, video swallows. And then also to just talk to people that are currently in the field. Try to find a mentor, either in a professor that specializes more in the medical setting, or finding a family member or a friend that also is in the setting is a great way to find someone that has some good advice for them.
And how can these new speech-language pathologist graduates develop their professional and clinical skills?
To develop the professional and clinical skills really does take a period of time. The medical setting is very dynamic, and just walking in, there's a lot to learn. So making sure that you have a strong CFY supervisor, that's the most important. Someone that's passionate about the setting, passionate about supervising, passionate about teaching, and then building from there and making sure that you have a good dialogue with that person. How am I doing? How can I progress? What are my strengths? What areas can I focus more upon? And then having that open dialogue, you're able to really find out what your strengths are in areas of focus in the future. And then letting them know, too, what you really enjoy doing. And I think that way you can build your skills, build your knowledge of where you're at and where you can grow.
I'm sure that you've worked in a number of different settings. You're familiar with the choices speech-language pathologists have. What are some of the benefits of choosing to work in a hospital setting?
A hospital setting is very dynamic, and you are never bored. There are so many different things that you can do, from the bedside swallow eval to a cognitive evaluation to a fiber optic evaluation of swallowing, all the way to AAC. You can work in the NICU. You can work all the way through into outpatient. So the majority of the experience is just incredible when it comes to the medical setting. I think the best thing about it is that I'm never bored, and one day is never like the other. So.
And how about the challenges? I know that it can be challenging at times, possibly stressful. Can you talk a little bit about those?
The medical setting is challenging because it's always changing, and you have to know best practice because in this setting there are things such as the trach, where you need to make sure that you know that the cuff is deflated in order to put on a passing mirror, because if you don't, then you can suffocate your patient. But being able to be aware of the best practice, it's the most rewarding. For example, I just saw a patient with an exacerbation of Guillain-Barré, and she hadn't been able to talk and was on a vent for a period of time. We were able to come in with respiratory therapy, deflate the cuff, put the passing mirror on, and she now is able to talk again. And that's one of the most rewarding experiences. Or a patient that suffered a traumatic brain injury or a stroke and not being able to eat for a period of time, working with them either through vital stim, biofeedback, or dysphagia exercises, they can again start to eat, which is one of the great pleasures in life. So those aspects, getting someone to regain speech and to regain swallowing function is just so rewarding. So it definitely outweighs the challenges. It's just you need to be able to be dynamic, flexible, and being curious to know best practice for your patient.
Well, thank you very much, Elizabeth. I'm sure that all these graduate students that are out there are going to enjoy your experience, and if they want to find more information, we'll probably try to get them more information on our website.
That sounds great. Yeah. Thank you.